Isolation technique or infection control at home. A medical aseptic practice in the home which inhibits the spread and transfer of pathogenic organisms by limiting the contacts of the patients and creating some kind of physical barrier between the patients and others. The purpose is to minimize transmission of infections in the hospital or community using correct understanding of how infections harm. And isolation should be done in a friendly, accepted manner that minimizes discomfort and unnecessary use. The principles are essential when performing isolation technique to achieve the best results or desired outcomes. Number 1, the frequent washing and airing of beddings and other articles and infections in the room. Number 2, wearing of protective gown to be used only within the room of the sick member. The guidelines or special considerations. Number 1, wear PPE at all times. Number 2, wash hands after procedures. And for the standard precautions, it is the steps that should be taken to prevent spread of infection from person to person when there is an anticipated contact with blood, body fluids, secretions such as phlegm, excretions such as urine and feces, non-intact skin such as open wound, and mucous membrane such as the mouth cavity. And the standard precautions include the use of one or combination of the following practices. The level of use will always depend on the anticipated contact with the client. The hand washing, the most important infection control method, use of latex or other protective gloves, mask, eye protection or face shield, gowns, proper handling of soiled client care equipment, proper environmental cleaning, minimal handling of soiled linen, proper disposal of needles, placement in a private room for clients who cannot maintain appropriate cleanliness or contain body fluids, and for the equipments, the PPE, the gown, mask, goggles, and gloves.
Good morning, ma'am. Ako si Nor-Aine, ma'am. So, your nurse for today. So, ikaw si Ana Cruz, ma'am, diba? So, mag-chat lang ko ni mo karon, ma'am, ha? So, mag-prepare sa ako, ma'am. Thank you.
Do the hand washing. Next is to don a gown by securely tie the gown at your neck and waist to make sure it doesn't slip down during patient care to protect the uniform of the nurse. Also use a new gown every time you enter the client's room and discard it as you leave the room. Never wear a contaminated gown into the areas of the house to prevent cross-contamination. Use mask for a client with diseases that spread respiratory droplets. To put on a mask, place it over your nose, mouth, and chin. Fit the flexible nose piece to the bridge of your nose before tying the mask in back. Then secure the ties at the middle of your head and neck. Use a new mask every time you enter the client's room and discard it as you leave the room to prevent cross-contamination. Then don the gloves and it should be covered the cuff of the gown at your wrist. And if your PPE becomes dirty, you must change it to prevent cross-contamination. Record all data and make appointment for a return home visit.